Cabinet considered this report yesterday and appointed PMNC, Prime Minister and Cabinet, to lead a cross-government task force to work through those recommendations and come back to the Cabinet. I think without doubt, though, the most important recommendation from this report is the establishment of a Centre for Disease Control, a CDC. As you know, Australia, at the beginning of this pandemic, was pretty much the only OECD nation without a central authoritative Centre for Disease Control. And it was an election promise from Anthony Albanese, made in one of his budget reply speeches, to close that gap and to establish a CDC here in Australia. The Treasurer approved $90 million in a previous budget to establish an interim CDC, which is now operating within the Department of Health. It is undertaking for participating, for example, in our stress testing of our ability to respond to an avian influenza event, and doing a range of other preparatory work, as the inquiry report makes clear, to establish a more permanent body. Today, I can announce the government is investing $251 million over the forward estimates, as well as funding ongoing, to establish an independent, authoritative Centre for Disease Control to commence from the 1st of January 2026. Legislation will be introduced into the Parliament next year to set out its independence and its functions in clear legislation. It will be headquartered here in Canberra, as is recommended, in order to be close to national decision-making. Its functions will very closely reflect the recommendations from this report. And importantly, this is something that we have been working very closely with states and territories about. And relatively recently, the state and territory health ministers, by resolution, indicated their support for a CDC to be established at a national level. The first priority of the CDC will be to establish a comprehensive joined-up data and surveillance system in partnership with states and territories, but to have a single, comprehensive, real-time data and surveillance system, and for our surveillance capability to be world-leading, including our use of wastewater surveillance, which we know has been so important. The CDC will be also responsible for providing independent, evidence-based advice about particularly a pandemic response, but more generally our responses to communicable diseases. It will also be responsible for engagement with regional and international partners. And I have to say, as I've engaged with a number of my colleagues from other countries, there is a huge enthusiasm among like-minded countries for Australia to close that global network, that gap in the global network, and for there to be a single authoritative body for CDCs from the US, from Europe, and so many other countries besides to engage with an important partner like Australia. It will also obviously be responsible for leading pandemic planning and testing, or stress testing, of our ability to respond to a pandemic in partnership with relevant departments, including my own, the Department of Health, and the National Emergency Management Authority, NEMA. This is an enormously valuable report from Robin and Angela and Catherine, and again I want to thank them for the work that they did. I want to thank the Secretariat from PMNC that worked so closely with them, and to all of those Australians who participated in this important process. And today's $251 million investment by this government is really an opportunity to lay a foundation for Australia's future pandemic preparedness.